Operator, I do think we're ready to start.
Thank you. Ladies and gentlemen, thank you for standing by, and welcome to the COVID-19 Media Briefing Conference Call. At this time, all participants are in the listen-only mode line. After the speaker's presentation, there will be a question-and-answer session. To ask a question during the session, you simply press star and the number 1 on your telephone keypad. Please be advised that today's conference is being recorded. If you require any further assistance, please press star 0. I would now like to hand the conference over to your speaker today, Michael Schumer. Thank you.
Thank you, Operator, and good afternoon to everyone. Thank you for joining us for the March 25th COVID-19 Media Briefing Call. We have a number of speakers on the agenda today, starting with Minnesota Governor Tim Walz. Following Governor Walz, we will have Minnesota Commissioner of Health, Jan Malcolm. After Commissioner Malcolm, we will hear from Joe Kelly, the Department of Public Safety's Director of Homeland Security and Emergency Management. Following Director Kelly, Commissioner Steve Grove from the Department of Employment and Economic Development will provide an update. We'll then hear from Minnesota Department of Education Deputy Commissioner Heather Mueller. Following the speaker's comments, we will be opening it up for media questions. And with that, I will now turn it over to Governor Walz.
Thank you, Mike. Good afternoon, everyone, members of the press and those that are listening in. I want to give a thank you for covering the 2 o'clock announcement and allowing Minnesotans to follow along as we address COVID-19. I think I hope we made it clear that Minnesota's plan is to ensure that every one of our neighbors gets the opportunity, if they need it, to have the medical care that they deserve, and we bring them out of this. We're trying to buy ourselves some time with the incredible social distancing and the discipline that Minnesotans have shown, with a little bit of short-term increased mitigation, and then a full-court press from our private sector partners, bringing in their expertise in supply chain management and other things to allow us to really ramp up that capacity, knowing that we're not going to stop this. The infections are going to come. But what we are going to stop is a situation where we get overwhelmed. We're going to do the best we can to stand that up. We are at this time analyzing the impact of the federal stimulus bill that's moving. Governors were all on a noon briefing. All 50 governors were on. And our federal folks with the National Governors Association were running through some of the positives there. I think there's reasons to be optimistic, especially for help from folks who have fallen through the cracks, independent contractors, smaller business owners, and help for the states. Once again, I remind Minnesotans that we work in conjunction with the legislature. We cannot appropriate funds without the legislature's help, and we cannot deficit spend in our states, which is a really good thing for balanced budgets, but it's really challenging in response to an unprecedented emergency. It's why we need our federal partners to do the best they can. And so I think there'll be a lot of questions at the end, but I was able to put out a lot of information at 2 o'clock. I'm going to move to Commissioner Malcolm, go through our team, and then we'll be glad to answer all the questions. So Commissioner Malcolm.
Thank you, Governor, and good afternoon, everyone. So today's kind of data report is as follows. Globally, the national total of global total of cases is more than 438,000 and 19,600 deaths. So this pandemic has quickly eclipsed other recent pandemics of concern. In the U.S., we are reporting over 55,000 confirmed cases, and we continue to watch with concern and compassion what's going on in New York, with now over 26,000 cases, an additional 3,600 in New Jersey, 2,600 in California, 2,500 in Washington State, almost 1,800 in Michigan, 1,600 Illinois, and almost 1,500 in Florida and 1,400 in the state of Louisiana. So those are the states that currently have the largest number of cases that are ahead of us by some number of weeks, we believe, but the states that we are learning from in terms of U.S.-specific data and data that will help us to continue to improve the model that Governor Walz previewed at 2 o'clock. In the United States, we're reporting 802 deaths, quite a rapid rise in both the number of cases and deaths in the U.S. just in the last 10 days. Here in Minnesota, we now are reporting a total of 287 laboratory-confirmed cases in Minnesota. That is up from 262 yesterday. We're still at a total of 1 death, which was announced March 21st. Since the start of the outbreak, a combined total of 35 patients with COVID-19 disease in Minnesota have been hospitalized. The rest of the positive cases have recovered at home. There are currently, as of today, 26 patients in the hospital, 12 of those in intensive care. As we've said before, this total of 287 lab-confirmed cases reflects only the results from laboratory testing. We know there are more cases in Minnesota and that the virus is circulating in our communities. And that's why it's so very important for everyone to follow health guidance if they are ill, if they are at high risk, and for everyone to follow the community mitigation and social distancing guidance no matter where in the state we are. Of interest, we've now had over 6,300 samples tested by the MDH lab and over 5,000 tested by external labs. We can talk at greater length about some of the limitations to testing and the strong directive from the governor to take these next couple of weeks to really build up a long-term sustainable plan for increasing testing in Minnesota as a big part of our response management plan going forward. In terms of public interest, of course, it remains very high. About 1,400 calls yesterday to the Health Department Public Hotline, which continues to operate 7 a.m. to 7 p.m. every day of the week, in addition to the State Emergency Operations Center hotline fielding other questions related to community mitigation, including schools and daycare. Our website continues to be very busy, averaging now about 700,000 plus hits per day. We appreciate people directing questions and directing folks to the MDH website, where we try to keep current guidance information and current information for the public and for various sectors of our state and health professionals, keep that current with updated guidance from the CDC and others. So that continues to be an important resource that you can help us direct Minnesotans to. I'm sure you will have questions about the modeling that Governor Walz previewed for Minnesota on his 2 o'clock video event. So I will just anticipate your questions later and turn it over to Director Joe Kelly at the State Emergency Operations Center. Thank you.
Thank you, Commissioner, and good afternoon, Minnesota. From the very busy State Emergency Operations Center in downtown St. Paul, this is Joe Kelly. Yesterday, I talked about helping expand the capacity of our hospitals and healthcare facilities. You heard the governor address that issue about an hour ago. We assembled our planning team yesterday, and today we brought in a very important group of experts from the statewide healthcare coordination group, and they bring a tremendous amount of knowledge, experience, existing plans, and other resources to our work to identify alternate care sites, which will supplement our hospitals and, most importantly, our capacity to care for the most critically ill. Our goal is to identify sites around the state, obtain the equipment and supplies to operate them, and then bring in the healthcare professionals that can take care of the patients. The physician who's on that team simplified the strategy for me by boiling it down to sites, stuff, and staff. And we are working on all 3 elements simultaneously as fast as we can, but job 1 is the sites, and then we'll address the stuff and the staff. Personal protective equipment, commonly referred to as PPE, continues to be an issue in hospitals and clinics for our healthcare workers and out on the street for first responders like our police officers and sheriff's deputies. Today, the Emergency Operations Center is coordinating delivery of masks specifically for use by law enforcement, and our troopers of the Minnesota State Patrol are making those deliveries happen around the state right now. We are, as the governor has pointed out several times, we are engaging Minnesota's great business community for their help to acquire, fabricate, store, and deliver the necessary PPE and critical medical equipment to our hospitals and other care facilities. Our partners from Minnesota Management and Budget, both here in the Operations Center and in their agency officers, are working tirelessly to ensure that state government has the people and the resources it needs to continue to provide those critical services that Minnesotans rely on, as well as assessing the impacts on the state's budget. With the stay-at-home order, I know Minnesotans have a whole new batch of questions and concerns. If you have a specific question on whether your work is considered essential under the executive order, please send an email to criticalsectors@state.mn.us. That's critical sectors, just one run-on word, at state.mn.us. I'll let Commissioner Steve Grove from the Department of Employment and Economic Development talk more about information for businesses, but there is a new website that provides information on the stay-at-home order. It's mn.gov/stayhomemn. So mn.gov/stayhomemn. There's a frequently asked questions link right in the middle of that page, so I ask you to please go there first. We'll bring our state hotline call takers up to speed as quickly as we can so they can be helpful to you between now and when the order takes effect. I've lived in Minnesota my whole life, and I'm very proud to be a Minnesotan, and our state's been through tough times before. I trust we're all going to do the right thing and comply with the stay-at-home order to minimize the spread of the virus and buy some time to get better prepared for if and when things get worse. And together we can protect each other, especially our most vulnerable family members, friends, and neighbors. We can do this. Now I'm going to turn it over to Commissioner Grove. Thank you.
Well, thank you, Director Kelly, and hello, everyone. I want to begin by providing some additional context on the governor's executive order on staying at home, particularly for businesses and workers, so that we can all understand what to expect in the coming 2 weeks. We know there's just a lot of questions coming in about what this means for our economy and for businesses, and we're going to provide as much guidance as we can to help businesses and workers during this time. First of all, when you see the executive order, you'll see a really detailed list of industry categories in that executive order that are considered critical. And that's our way of demonstrating which businesses we ask to remain open, that need to remain open, and that are critical to keep our economy running. It draws from the Department of Homeland Security's critical infrastructure guidance, which you heard the governor mention during his video press briefing. You can find that list also at CISA.gov, that's CISA.gov. We've gone even further than that CISA guidance to provide some additional industries that we believe are critical for Minnesota in the coming weeks. And you may be surprised to know that by doing that analysis, we believe that about 78% of the jobs in Minnesota are in critical industries as defined by the executive order. That's 78% of the jobs in our state are in these critical industries. So it's just 22% of the jobs in the state that are not, and that includes the bars and restaurants and places of public amusement that have already been closed. So that's the shape of the critical industries and the non-critical industries based on this executive order. And we know that businesses across the state are going to want further clarity, and so we've been working as much as we can to provide some additional guidance beyond just that list of industries. And this is something that our team has been working hard on. I don't think any other state has done this so far, and we hope it's useful to people. What we've done is we've looked at each of those industries and fleshed them out by about 173 occupational categories that will just give businesses a little crisper sense of if they qualify as a critical industry or not. You can find that list at www.mn.gov/deed, that's DEED, /critical. We hope that this guidance is going to provide a lot more clarification on which businesses should remain open and which should temporarily close. But we know there will still be questions. And so for further clarity, there's an online form you can fill out at that same website. Again, mn.gov/DEED /critical. And the Department of Administration is going to be managing that form and can provide further guidance to our businesses to make sure everyone understands who should stay open and who should temporarily close during this stay-at-home period of 2 weeks. Now, as the governor said, we've been weighing the economic impact of this decision, and we know it does affect so many Minnesotans. Our estimate is that about 28% of Minnesotans will be temporarily jobless as a result of all the executive orders issued thus far. Important not to call that an unemployment rate, because they're not unemployed, they're just temporarily jobless during this 2-week period. And when we look at those jobs that are affected, we believe that about 59% of those not working will have access to some kind of paid leave. And I just want to say that we've seen businesses across the state affected by COVID-19 do everything they can to keep workers on their payroll, offer them paid leave, keep them getting health insurance, which is just critical during this time. And we're so grateful to have a business community that's doing everything it can on that front. And we applaud every business to do that and to encourage to do that where they can. And we know that many can't. And for those who can't, and for workers who are separated from their jobs, we do encourage them to apply for unemployment insurance. That program is here to help. We do expect after today's announcement to see an influx of applications, and so the team is really working hard to prepare for that influx and make sure that we can make some adjustments to help applicants through this process, particularly given that 85% of the applicants to unemployment insurance are new to the program. So they're kind of learning this program for the first time. And as I've said before on these calls, we just don't have the capacity to take informational calls in our phone lines at the rate that they're coming in. The wait times are incredibly long, and so we really need to reserve that phone line for non-English speakers. So you'll begin to see our informational phone lines switch off as we move into processing applications and claims, and really a shift to drawing people to our website to answer questions. That's uimn.org. But we also wanted to announce today a new effort to empower friends and family to help guide applications or applicants through this process. It's sort of a phone a friend strategy, if you will, and we've essentially posted a script on our website on Deed's COVID-19 information page where a friend or a family member can look at that script, walk a friend or family member who might be having trouble applying for unemployment insurance just to get all the details right and make sure that you're all signed up and ready to go. So it is posted in the upper right-hand corner of our homepage at the Department of Employment and Economic Development. That's mn.gov/deed. And we hope that friends and family take that opportunity to help their loved ones navigate that application process. I did want to give an update on the statistics as it relates to unemployment insurance applications. Thus far, since the COVID-19 crisis began, we are at 164,786 applications. That's 164,786. Since yesterday, we've seen an uptick of about 15,168. You heard yesterday we did a demographic analysis. We'll continue to do that on a weekly basis. We think that's about the right cadence to give the public updates on the demographic composition of these applications. As we mentioned yesterday, the industry most affected, not surprisingly, is restaurants and food service, which is about a third of the applications. We have seen women disproportionately affected by some of these closures, bumping up from 33% on average applications up to 66%. And young people as well. That category that's seen the biggest jump is the people between 22 and 29. Lastly, I did want to say that while so many businesses are slow to hire right now, given some of the challenges our economy faces, many other are hiring like crazy. And you've seen that at a national level. CVS Health announced plans this week to hire 50,000 workers across the country. Walmart's hiring another 150,000 jobs. We've seen on our state job bank about 3,650 new job openings. 23% of those are hospitals and nursing homes, which is not surprising. There's huge demand there. And so we just want to highlight that for workers who are seeking employment or who may be shifting employment given the dynamics at play. Here in Minnesota, we've seen a lot of employers, U.S. Bank, Hormel, Target, announce temporary bonuses or pay increases for some employees, which is great to see. Grocery stores are hiring for a variety of frontline positions, including online personal shoppers, stockers, cashiers. Grocers like Cub Foods and Lund's and Kowalski's are raising wages and doing more to help workers at this time, and smaller independent grocery stores are doing that as well. I should also say that state government is continuing to hire. The Minnesota Department of Corrections, for example, is seeking trainee corrections officers at facilities across the state with immediate openings. Starting wage for these jobs is $20.55 an hour, and you don't need any experience in corrections, and you get a 6-week paid training program. So just to note, there is a lot of hiring going on in many occupations. We took a look at the data and noted that in the past week, the top 5 industries that are hiring are healthcare, transportation and material moving, sales and related grocery and retail clerks, office administrative jobs, and computer-related occupations. So there is growth in our economy amidst these challenges. We're excited for this next few weeks to partner with the private sector on really using this 2-week stay-at-home period to collaborate with Minnesota companies and businesses as we enter this new phase of our efforts to combat the crisis. So with that, I will turn it over to Heather Mueller, our Deputy Commissioner at the Department of Education. Heather.
Thank you. Hello, everyone. Good afternoon. I would like to take this opportunity to thank Governor Walz, Lieutenant Governor Flanagan, and our state agency colleagues for their leadership, support, and partnership throughout this unprecedented time. Their work on behalf of our statewide community has consistently put students and families at the center to ensure their safety and well-being. The commitment to provide continuity in learning and teaching reinforces their support of equitable education for students throughout Minnesota, as well as their commitment to the high-quality education that we've come to expect in our state. Education matters, learning matters, and instruction matters. Today, the governor made official something that we already know, that our school staff is vital to our communities. The decision to move to the implementation of distance learning plans was not taken lightly. The planning that our educators have done over the past 8 days has helped to reinforce our belief that allowing schools and school districts to implement a distance learning model will benefit all of Minnesota. Educators are public servants. They have stepped up during the planning period to provide meals to families that need them and provide care for the school-aged children of our critical workers so that we can continue to preserve the health, safety, and lives of Minnesotans. We are calling on them again to step up to support these important community efforts, and I know that they will continue to meet this moment and this call to serve our neighbors who need us the most. We've heard from our districts and our charter schools that the restrictions on the different funding streams has made it difficult to pay for their school staff for the work that they've been asked to do. So that is why the governor's executive order also authorizes school districts and charter schools to transfer operating funds from any program that is not already assigned to or encumbered by staff salary and benefits to provide school-aged care to critical workers and any additional transportation costs incurred between March 30th, 2020 and April 30th, 2020. Every decision the governor has made around the education has been for the benefit of our students. The U.S. Department of Education announced last week that they would grant a waiver for the federally mandated standardized statewide assessment requirements to states that are impacted by school closures. As a result, Minnesota sought the federal waiver, and in accordance with that waiver, we will be canceling the MCA for the remainder of the 2019-2020 school year. Before I hand it back to the governor, I just want to say a couple of words to our students, families, and educators. To our students, I want you to know that your educators and school staff communities miss you. You are the reason that we choose to do this work. We believe in you, we support you, and we value who you are and what you bring into our learning environments. While this is not the spring that you thought we would have with you, and it is not the spring, it is the spring that we do have with you. It does not change our commitment to you and to your learning. To our families, I know that having your students at home with you can seem daunting, and you're worried about how you are going to assist them in their learning. I want you to know that no one is expecting you to turn into teachers. Our educators in Minnesota are still here for your students, and they put together very thoughtful distant learning plans to prove it. Finally, I'd like to thank our educators and school staff for their tireless work, not just today or over the past 8 days, but for their entire careers. Although this may not be the teaching and learning environment that you thought you would be using exclusively this spring, this simple fact remains true. You are dedicated professionals who have been trained to support the learning of our students. Regardless of the instructional platform, you are educating our students and preparing them for what comes next in their lives. Every single person in our school buildings plays an important role in our students' learning. Stepping forward to lead in your communities demonstrates your willingness to put others before yourself, and it is remarkable. While things are constantly changing, your commitment to our students has always remained firm, and we cannot thank you enough for your partnership. Together as one Minnesota, we will move forward. Thank you, and now I'd like to hand it back to the governor.
Thank you, Deputy Commissioner Mueller. To all of the commissioners, thank you for your leadership. You are the team that Minnesota needs and deserves, and my pledge to Minnesotans who are listening is we need to be flexible and innovative in our thinking at this point in time, always putting our citizens first and being creative. This is an unprecedented time. Governors are talking together about building consortiums together in the upper Midwest. We're trying to look to data in real time and adjust accordingly. This is a time for state government to do the things that it does well and also to learn how we can be more nimble. So with that, I'm going to open it up to the press and fire away.
Operator, at this point, we'd like to open it up for questions from reporters on the line.
Thank you, sir. As a reminder, to ask a question, you simply need to press star 1 on your telephone keypad. If you'd like to withdraw that question, press the pound key. Our first question comes from Tom Hauser from KSTP-TV.
Hello, Governor. A couple of quick questions for you. I know we've got 100 of them. You had talked earlier in your 2 o'clock about, at one point, one of the models showed the potential for 74,000 deaths in Minnesota. Could you clarify what you meant by that? And is that only if there were no mitigation having taken place? And then I'll have a follow-up when you're done answering that.
Sure, Tom. Yeah, the epidemiologists and the modeling shows that not doing anything. Obviously, that's not the case. We took significant movement, and the data seems to support we're getting as good of results on that as any place. That's the number that, without significant mitigation, leaving things alone, where it would have overwhelmed our healthcare system, and those would have happened. So that's where that number's coming from.
Okay, and then a quick follow-up. Getting a lot of emails from, obviously, people who work at large companies wondering if they're impacted, and I know there is that email address that people can go to. But just in general, big employers in Minnesota like Cambria, Caterpillar, big manufacturers, are they going to close down? Are those thousands of workers going to be out of work for a couple of weeks? And then finally, everybody's asking, or many people, are liquor stores going to remain open?
Well, first of all, liquor stores will, and it's not a flippant question. When people say that I know it's one of the things that relieves people, and adults make choices that they need, so those will remain open. And I can say about the large employers, some of those have taken measures because of the lack of orders to slow down. Without going into specific companies and those critical needs assets, that many of them will be asked to leave their employees home. Commissioner Grove gave kind of a rundown of who's covered and how many are in the critical industries piece of that. But I don't want to get into the specifics on some of this because, like we know, we still need to have certain things manufactured so the state can continue on. We're monitoring very closely. Joe Kelly's monitoring every day and updating me on water levels. And I'm asking him about rainfall totals and has it moved the needle on potential flooding, and so equipment that's being manufactured in that. So I don't want to get into the individuals. I would refer people back to that. And I also want to send out a message to those employers that are out there, both big and small, that we want to make sure that we're listening on this. If there's changes that we can make, if there's things that you are doing that you're sending most people to work from home or wherever that might matter, we want to hear that.
Okay, thank you, Governor.
Our next question comes from Tim Nelson of Minnesota Public Radio.
Hi, Governor. A couple questions here. First, you have mentioned that you have possible contact with a COVID case. We're wondering what the plan is if you, in fact, grow ill. And the other thing is, you said that you're talking to 3M and Medtronic and other Minnesota manufacturers. Are you asking them to reserve some of their production for Minnesota care providers?
Yeah, I'll answer the second one first. What I'm asking them to do is some of them have their own stocks on hand, and we've asked companies, and they've stepped up. Ecolab is one, where they have their own stocks for their production. If they've changed to telecommuting and things like that, they've been able to do that. What I've been asking them, and this is a challenge, and there's an ethical question behind this. One of the things that we're running into is that we're watching the federal government tell the states to go out and get it. We're going out through our purchasing, our supply chains, and we're being outbid, and the federal government's taking it, putting it into the national stockpile, and then doling it back out to states, which in a very coherent and structured strategy makes sense. But governors were just on at noon trying to understand how that happens. And as Governor Hogan of Maryland stated, they're telling us to go get it. We're trying. They're getting it, and then they're doing a press conference telling us that they just delivered millions. So what I'm asking is what's the capacity? What can be left for Minnesota? And as someone said to me, we're certainly willing to help New York and our fellow Americans in any way we can. But at this point in time, without a cohesive national strategy, I have got to use and stand up the manufacturing that I can here. And and that's what I've asked them for. Is in regards to me, and at this point, I have no symptoms. I'm still going about my life here. We have a very clear order in place. We executed it last summer when I went in for elective surgery on my knee. Should the determination, and it is 3 people that are designated, including my doctor, if the need is that I am not able to perform my duties, that transfers to the lieutenant governor, who I think Minnesotans can rest assured is in every single briefing, is at every single table, and is up to speed on this. So there is a clear and orderly transition should that be needed, knock on wood.
So does that mean that you expect that some of the Minnesota manufacturing will not go to the national stockpile and will stay in state?
They will fulfill their requirements to them, but as they stand up and excess capacity comes out and things that they already have on outside of that, the federal government is asking them to deliver a certain amount. They're not exercising the Defense Production Act, and there's reasons for Medtronic being an example is multinational manufacturers elsewhere, and that could break a supply chain issue. But I am asking them, with excess capacity and excess stockpiles of their own, to help with Minnesota, not at the detriment of the rest of the company, but to step that up for us.
Thank you.
Our next question comes from Lou Ragush from KARE 11 News.
Hi there, Governor and Commissioner Malcolm. On the issue of COVID-19 testing, I'm curious if there's no testing backlog anymore. We're still hearing from some patients that have gone over a week without hearing their results. I'm wondering why that might be. And also, is Minnesota nearing a place where it can increase testing and try to isolate like asymptomatic carriers like some countries are attempting to do?
Yeah, great question, Jan. I'd like you to take the time to explain this in detail, because there's some misinformation out there. So please do it, Commissioner.
Absolutely. Thank you, Governor. Thanks for the question. Clearly, testing and what's going on with that and what are we doing in the immediate future versus what's our long-term plan are really, really important questions. As the governor said in his 2 o'clock video, the lack of a really strong national testing approach early on in this epidemic was really a lost opportunity in terms of time. I think in Minnesota, even though we've had our challenges, our volume of testing is quite respectable compared to most of our peers. But we have had, first we had a lot of problems in the supply chain, not only with just getting the testing kits from the CDC, but also not just what was in the kits, because you'd think the kit contains everything you need, but that's not the case. You also need chemicals to run the tests and laboratory equipment. So for a period of time, we had some supply chain problems there. We've worked really hard to be flexible, and Governor talks about innovation, to adjust our methods and switch platforms so we could make the most use of every ounce of reagent that we could get, for example. So the Public Health Lab has been able to ramp up testing capacity, and we have partners, the Mayo Clinic, others in Minnesota are also stepping up to be able to test. So the laboratory capacity is in much better shape now, although we can continue to keep our eye on the global supply chain issues with respect to the chemicals and so forth. But now the issue has shifted to supply chain concerns and human resource concerns on the care delivery side, where the swabs are collected. So we can process the samples, but getting the samples has become a challenge, with things like the nasopharyngeal swabs being in critically short supply, and many of the health systems don't have any swabs to swab patients. All of that has led to the need to prioritize tests to make sure that we can test everyone who's in the hospital, because as Chris Erzman has said multiple times, that's where it really matters to the clinical care. Of course, we want to be able to test more people to understand the spread of the disease in the community and to get individuals the information they're eager to have about whether what they have is COVID or another kind of a respiratory illness. And that will be something that we will be building up a sustainable strategy for Minnesota to figure out, back to the governor's supply chain point, how are we going to get swabs? Are we going to manufacture swabs here in Minnesota so that we can deal with some of these supply chain issues? The backlog has been managed down. There still is a limitation on testing because of now the swabs. But to speak to the question about lag time in reporting of negative results, there's a couple things going on there, positive or negative results. Some of the testing is being done by national laboratories, not in Minnesota. And so we're pretty confident of our turnaround times on our testing. In terms of the communication back to patients happens from the individual provider who has that relationship with the patient. So the test results are reported back to that provider. And for us, we try to hit a 24-hour turnaround time to get those test results back to the provider. In the case of some of the clinics who are using national labs, we don't have much transparency into their timelines or their feedback process back to the providers. I know that's a lot, but hopefully that answers your question.
Thank you very much.
Our next question comes from Mary LaHammer from PBS.
Hello, Governor. I wonder if you've seen the statement from Senate Majority Leader Paul Gazelka. He said that he has grave concerns about your order and the impact it will have on families and jobs. Can you react to that?
I have not seen it, Mary. I would just say that I, as governor, have to make the best decisions I can in this environment, working with the legislature. Certainly understand that not all will agree, but I think taking in the best data from our healthcare professionals, both in state government and out of state government, and the best data, this is what I could do. But I know that in a democracy, there's always healthy debates, but at this point in time, I just need to stay focused on my lane.
Governor, if I could follow up, are there concerns that this is getting partisan at a state and a federal level, pushing to get back to work?
Well, I certainly hope not. I think that the concern that people are showing about the economy, I hope they're feeling the sense that I have of that too. I understand the impact that has on people. I also understand that not taking these actions will result in the deaths of Minnesotans. And I think trying to balance those in a way that makes sense, that, as you heard, 78% of our folks are still working. We have a safety net in place as we get through this. So the idea that this is a false choice between the economy and protecting people, if there is a better way other than just send everybody back, because my data shows me, and it was my first scenario run by the University of Minnesota and MDH, shows what will happen if you just send them back. So I hope it does not become. I think there is plenty of room for lots of thought, and I can tell you what I think all of the press listening on this is a very, very different conversation when the governors are on together. And the governor suggested not having press on with the president anymore because some of the governors are fearful of speaking out, because when we're on together, it is the brass tacks of what's needed. And it is absolutely no one cares. I had an incredible conversation with Doug Burgum. We're very different. We philosophically and politically, but he is a good leader doing the right things for North Dakota, and he's working with me. So I hope we don't get there. I hope that's not the case.
Our next question comes from Peter Cox of Minnesota Public Radio.
Hi, Commissioner Malcolm. I'm wondering if the MDH hospital count includes only confirmed COVID patients, or if hospitals might be working with patients who are showing symptoms but haven't been confirmed cases yet, and if they're included in the count or not.
Thank you for that question. The hospitalized patients are just those with positive COVID tests, but we're testing everyone who's hospitalized who's suspicious for COVID. That is our top priority testing population. So we feel, I can't guarantee it for sure, but we feel fairly confident that we do have a good line of sight into what's happening in the inpatient settings.
Our next question comes from Cody Nelson of Minnesota Public Radio.
Hi, y'all. I'm wondering what guidance has gone to law enforcement in terms of enforcing this executive order, or if it's not gone out yet, what you're expecting in terms of enforcement on things like the gathering in public spaces, et cetera.
Yes, thank you. It's a great question. And we're focused on the education piece of this, obviously over enforcement. And through this whole thing, Commissioner Harrington and local law enforcement partners have been reporting back. And as expected for Minnesotans, very few violations. And when they are, they're just asking people to adhere to them. We obviously do need to enforce it. They are getting guidance on what they need to do. At this point in time, we've seen no, an organized effort to not comply, because I think Minnesotans understand what's at stake here. But they are being given guidance. We are focused heavily on the education piece of this. It is not our desire to write someone a ticket. It's our desire to protect the public's health.
Great. Thank you.
Our next question comes from Kevin Featherly from Gannett.
Hi, Governor. I wanted to follow up on a question I asked you last week when I asked you about the response in the jails and the prisons in terms of getting people out, nonviolent offenders. I want to get an update on that and see if you've seen much response on that front, and also to kind of get your assessment on how the courts are reacting and how both sort of in the criminal justice realm are aiding you in your response to this crisis.
Yeah, it's a great question. And the thing is, Kevin, we talked about one of the ways we were looking at that we would have the capacity to be able to do is folks who are scheduled for release within, say, the next 90 days that are already scheduled in release. Commissioner Snell has some capacity to be able to move those up. We're trying to see what we can do to accelerate that and to get them out. They're symptom-free. They're out of there because, again, it is a deep concern of ours that we monitor every morning about what would happen in that situation if we had more widespread infections in prison. So we are working on that. There is some attempt. I can try and get back with him, and maybe I will ask my team to provide you any numbers of what has happened up to this point and what we're doing. As far as the courts working with us, as I said, Chief Justice Gilday has been involved from the very first meetings where she sat down making decisions on the independent judiciary that needs to be done. They're moving cases out. I think the things of the civil cases that aren't a priority and trying to find ways that they can assist. So we're staying in close communication. We're letting them see and understand what these executive orders do, making sure that their feedback's coming to us if there would be an impact on them. So at this point in time, it's slowing, the courts are slowing down. Which makes a difference. We still have law enforcement. We still need to keep the public safe. But that's where it stands as of today.
A quick follow, if I may. I think you probably heard that there was a judge who may have been impacted with the COVID virus in Pope County. I wonder if you have any thoughts about that situation.
Yeah, and again, all folks who come in contact, and again, critical workers, the judiciary is. We certainly want to make sure that their health and safety is first. I just got an initial brief on that before I sat down for the 2:00 address, and it sounds like they are having folks self-quarantine themselves who came in contact with the judge. And, of course, as their dockets go, the judiciary will manage moving some of those around. But this is the type of thing, and as I said several days ago, given enough time here, it's just going to take a little bit of time. All of us are going to be impacted fairly close to home. It's just how we manage those infections.
Thank you.
Our next call comes from Theo Keith from Fox 9 Minneapolis.
Hi, Governor. A couple of questions. You mentioned a few times in your televised speech the modeling and day 150. I'm wondering if you can tell us what day we're on right now, if day 150, might be the peak. And secondly, I just want to clarify, if somebody breaks this order, leaves their house for something that's not essential, that's not one of the exemptions, covered in your executive order. Are they going to be arrested? Can they be arrested, or do you not want them to be arrested and just warned?
We don't want them to be arrested, first and foremost. We want to educate people, and I know that this requires voluntary social compliance to a large part. We want to educate them, understand. There may be a very valid reason why they're doing that. We don't want to assume that there's not. We certainly would have the ability to, but I can tell you that we have no desire to do that. In response to your first question, from that modeling date, Theo, and the numbers that we inputted to it, this is day 4.
Thank you.
So it can kind of tell you where we're headed.
All right, and our next question comes from David Orrick from Pioneer Press.
Hi, thank you, Governor. The worst case scenario, 74,000 people are dead if we do nothing. The plan you're recommending, how many die? Over what time period?
It will be dependent on the work that we're able to do on the mitigation, Dave. That if we're able, as I said, there will be a certain percentage of folks that this will hit harder, those that are older, immune-compromised, underlying health issues. We do know that the rate of survival of someone who is in that 5% who hits the ICU, if they get proper ICU, we increase it by 10%. So in the modeling, and I certainly am not going to put that out to scare people, that we will put it out and we're looking in it to set that number as low as we possibly can with the capacity to lift up those ICU units. We don't want to make the choice that they've had to make in Italy of choosing who gets a ventilator and who's not. There's no guarantee that if you get in an ICU unit, you're one of the people that get hit the hardest, that you're going to survive. It's just a much better chance. So what I can tell you is there is a drastic reduction if we're able to stand up what our healthcare experts tell us and what the modeling shows the number of beds we need. You keep hearing it in New York City where Governor Cuomo is telling how many they need. This is the same scenario. I think the difference is it's very hard for Governor Cuomo to buy more time. We're able to. So I can tell you this, that we will save lives if we do this. We can't, of course, with great certainty guarantee everyone because this hits people differently, but we will guarantee and trying to do all we can to make sure they get the best care.
I respect that, Governor, but this is taxpayer-paid models, and you've given us the number of people that will die if we do nothing. And why won't you tell us at least what the models predict the range is, based on compliance and everything you've said, for how many deaths we're looking at here?
Because the original model was based on the international, and as we started to put Minnesota in, that is the best case scenario they could give us. We need a little more time to get more Minnesota-specific data as the cases hit the hospital. We will do our best to show you the underhood of this. This is, and the researchers are very clear to tell me there is a margin of error in this. As anything, assumptions are being made. I think what we should try and do, Dave, and I do agree with you that'd be helpful, is to see what the models were predicated on, to see the inputs that you put in and where they move to give people a better idea. So I will get back to my team. I think it's a very valid point. We're just not prepared to do it at this time, but I hear you.
Operator, we have time for one more question.
Thank you.
All right, our next question comes from Steve Karnowski from Associated Press.
Yeah. Hi, Governor. Just can you tell us a little bit about what went on in your mind these last several days as you were waiting for more data to make this decision to pull the trigger?
Yeah, thank you, Steve. Well, much. I think as you're trying to get, and you wish it would be enough if you could get enough information in to have a certainty about the decision making, and you want to try and get as much as possible. It felt over these last several weeks very frustrating and a little bit adrift in terms of big decisions were being made, and I'll certainly never second guess the governors as they're making them one way or another, because some of this is being based on their best judgments once that data came in. So I was hopeful over the last few days that we would start to create a Minnesota model that would start to get us an idea so that I could make the case if I'm going to ask Minnesotans to sacrifice and do a shutdown, what is my purpose and what can I get them for that? Because I do think there was this belief that, well, if you just shut everything down and we shelter in place for a while, this will pass over like a rainstorm or something. That nothing could be further from the truth. So I had to weigh those different variables. And so I'm just grateful, recognizing, and I think Dave's point on the previous question is well taken. There are assumptions going into this, and assumptions going in are going to impact results coming out. And so I think I feel like I have a better sight picture on where we're at. I feel like we have a better course of action in talking to the manufacturers and to the healthcare systems in what they're able to step up. I can get a concrete view of how many ICU beds I can have stood up before we hit that critical date that we pushed out, and that will give me an idea of will we be able to stay under the number, or will further moves and further supply chain things need to be done. But those are all the things that are going into it. It's just the desire to get as much information as you can, understanding that these are hugely consequential decisions that impact people, and those who, if you're not sick yet and it seems like there's only 267 cases and one person died, what's the big deal? It's the big deal of the science behind epidemiology, and where this ends up is just an unacceptable loss of life and an unacceptable disruption to life one way or another. So that's what we've been thinking. It will continue to evolve. We will continue to change as the epidemic changes. But one thing is certain that, and I can't stress this enough, just the sense of Minnesotans. I get these good stories every day. I read them or I send them to my team. And I read one. I'm deeply concerned about our veterans' homes. I'm deeply concerned because of just the susceptibility of folks there. But over at the Minneapolis Veterans Home, we had some grandkids who couldn't get in to see their veteran, their grandpa, and they drew chalk drawings and communicated outside the windows, not just with their grandpa, but thanking the staff at the Minneapolis Veterans Home. So I'm giving a virtual hug to all of those kids who thought about their elders, thought about their grandparents, and thought about the healthcare providers. I see these stories coming up every day. Hennepin County Medical Center has a portal. If you want to do something, go on there and give a shout out to the hardest working people, these frontline medical folks. So I want to thank you all for joining us. We'll be back with you again tomorrow.
Thank you, Governor, and thank you to everyone for joining us for today's call. Any reporters who may have questions following the call are welcome to contact the communications offices at the various state agencies. And thank you, and we'll talk with you again tomorrow.
This concludes today's conference. You may now disconnect.